Hello, I'm Federico Aquino III, and I'm here to present to you my paper entitled Outcomes and Complication of Delayed Open Reduction and Kirschner Wire Fixation for Displaced Radial Neck Fractures in Children aged 5 to 18 years. Radial neck fractures occur in 5 to 10% of all elbow fractures in the pediatric population, usually at 9 to 10 years of age with equal gender distribution. The injury usually happens due to fall on the outstretched hand, and it affects both the radial neck and the metaphyseal area. The O'Brien classification is used to determine the angulation of injury and may help us decide the treatment outcomes and possible complications. A more invasive reduction is necessary for children with higher initial O'Brien grades, higher angulation and displacement, and a non-anatomically reduced fracture. To help close the gap in understanding these injuries and their complications, I conducted this study in order for us to determine the outcomes and complications of delayed open reduction and pinning surgery among children diagnosed with delayed displaced radial neck fractures, with specific objectives of describing clinical characteristics of children with displaced radial neck fractures managed by delayed open reduction, and to determine their functional outcomes, clinical outcomes, complication, and patient satisfaction on final follow-up. For patient selection, this paper utilized a cross-sectional study with a computed sample size of 10 patients utilizing a 95% confidence interval. So both the inclusion and exclusion criteria are as follows. The initial investigation was acquired using the clinical profile and the baseline clinical data of each patient. We made use of the chart review from medical records and preoperative radiographs of elbow, AP, and lateral x-rays. The clinical profile are noted as follows, and the baseline clinical data was done using the ASSE scoring system to check for the following parameters. Operatively, the surgeon who did the case was under the children's orthopedic unit of the hospital, and a posterolateral incision was done in order for us to gain access through the bone and reduce it anatomically. Intraoperative x-rays were also used in order for us to check for the reduction. After open reduction, we applied two 0.062K wires for internal fixation and did a final x-ray to assess final reduction and fixation. After which, patients were placed in a cast immobilization in 90-degree flexion and neutral forearm rotation for 4 to 5 weeks. On follow-up, a complete and thorough examination and history taking was done, and we acquired the most recent radiographs to check for union. We assessed for elbow range of motion, stability, strength, and physical signs, and possible complication, and made use of the ASSE scoring system to determine function. Statistical analysis was computed at 0.05 significance level, utilizing the following formulas in order for us to acquire the data. For the baseline results, we noted that the average age was 10 years old, an observation by other authors who indicated that older children sustain more severe fractures than younger children. Its predominantly sex was female, however, literature would say that the injury is equal to both genders. The mean angulation was of 70.8 degrees, and it was observed that high unabsorbed energy causes more severe injury in older children, and the average time between injury to surgery took about 2.8 weeks, which may be related to poor health-seeking behaviors, lack of medical care, and easy availability of over-the-counter pain medications. For the results of pain assessment in particular, children no longer had pain when doing a task with repeated elbow movements or lifting heavy objects. The pain experienced by the children significantly improved since all had no pain. The functional assessment was evaluated by the following tasks noted on the right of the screen, and results show no difficulty in doing all activities on final follow-up. For the range of motion, general results show improvement on range of motion for both left and the right elbow, However, flexion extension arc on final follow-up for the right was noted to be not significant. For elbow stability, there was no valgus instability noted on both extremities during final follow-up. For the strength assessment, we noted that there was mean strength improvement on flexion, extension, pronation, and supination of both extremities during final follow-up. For the radiocapitellar tenderness, there was no pain or discomfort on both extremities during final evaluation. We also did note that there was no occurrence of a vascular necrosis or a cubitus varus. However, a small number of patients, 2 out of 18, had heterotrophic ossification, which was computed at 11.1%. And for the clinical profile and heterotrophic ossification, there was no association between the factors and incidence of heterotrophic ossification. For patient satisfaction, high satisfaction among patients who underwent delayed open reduction and pinning was noted, with the highest of 10 and the lowest of 9. In summary, open reduction and pinning of displaced radial neck fractures improved clinical and functional outcomes. Radiographic examination and clinical union was seen in all our patients, with minimal loss of range of motion observed, but both arms are functional without difficulty in performing all tasks. Significant improvement in elbow pain, function, motion, strength, and stability with insignificant post-operative complications was noted. In conclusion, there is benefit in delayed open reduction pinning surgery for treating displaced radial neck fractures in children, and it is a viable option to manage such injuries in the pediatric population. Thank you.